Hello, everybody, and thank you for joining today. We're just going to give folks a few minutes to get on here and get started. Okay, hello and welcome to today's webinar. We'll be covering WACARE's basics, what workers need to know. My name is Sam, and I am the WACARE's Fund Communications and Marketing Manager, joined today by Sebastian, the Outreach and Language Access Lead at WACARE's, and together we'll be hosting today's presentation. We do have live interpretation available for today's webinar. You can find that by clicking on the interpretation button at the bottom of your screen and choosing the language you would like to listen in. And we have an American Sign Language channel you can choose from. We do have the DSHS customer care team today in chat that will be answering questions. You can ask questions at any time during the presentation using the Q&A function at the bottom of your screen. Anyone who has joined today's presentation using a computer or the Zoom app can submit questions through that Q&A function. If we're unable to answer your question during the allotted time, we will email a response to you to the email that you registered with. This webinar will be recorded, and the recording along with the slides will be available on our website at wacaresfund.wa.gov/webinars. You can see it there at the bottom of the slide, and they'll be available within 24 hours of the end of the presentation. And now I'll pass it to Sebastian, and he'll start the presentation by defining long-term care and caregiving.
All right, thank you, Sam, and welcome everyone. Thanks for joining us. So like Sam mentioned, we'll start with defining long-term care, just to sort of start the conversation. So long-term care is help with activities of daily living. That can be bathing, eating, moving around, and managing medication. It doesn't include medical care, though, so things like doctor's visits and treatment for medical conditions. And long-term care isn't just for older people. It can also help a lot of younger people with maybe a disability, an injury, or a severe illness as well. And a lot of folks think long-term care means living in a nursing home or maybe an assisted living, but it can also include in-home care and other services that we'll talk about. So WACARES covers in-home care and many other services that include home modifications, home delivered meals, all which help you live at home as you age. In-home care can also support mental and emotional well-being in addition to physical support. So a study done in 2025 showed that home care significantly reduced people receiving care's symptoms of depression, improved their quality of life, and lowered their risk of loneliness as well. So with the right support, most people with long-term care needs can keep living independently in their own homes. It's also very common for family caregivers to not realize that they are in fact a caregiver. So you might go to your mom's house maybe a couple times a week to cook meals, drive her to appointments, and make sure she's taking her medications, all of which are very, common care activities. And the majority of this type of care is provided informally. So meaning that it's unpaid care from a family member, could also be a friend, a neighbor. So we're going to start and launch a poll here, really to get a sense of the group's experience with long-term care, everyone here, what our experiences with long-term care, caregiving, and also how familiar we are with the WACARES Fund. So you should be seeing that pop up on your screen. If you joined by computer or the Zoom app, you can go ahead and answer those questions. And then, we'll get a sense of what sort of what our experience is as a group here, and also familiarity with the WACARES Fund. So I'll give you all a couple minutes here to just answer those questions, and we'll see what we what we have. All right, so looks like the results are in. For the first question around our experience with long-term care and caregiving, looks like most of us, over 50% of us here, have indicated that they work in long-term care or related fields, so very familiar with what that is, what the experience of long-term care is and caregiving. We also have about 30% have provided unpaid care to a family member or loved one in the past, so something that is very close to a lot of us here. And then another about 25% don't have direct experience and are not familiar with long-term care. So kind of a broad range here, which is great. And then in terms of our knowledge of the Walk Cares Fund, looks like over 50% of us are somewhat familiar, which is also great to see. And then about 30% are not very familiar. So glad you all are here just to learn more, which we'll touch on in sort of the second half of the presentation, more specifically about what the program entails. So like a lot of us here, as we clearly saw through those results, we all have, right? A lot of us have care stories in our families, and maybe if not in our families, in our communities more broadly. So in our state, there are around 820,000 family caregivers, which comes up to 11% of the population. And we want to just highlight one story of those many from a Washington family doing the kind of caregiving that Walk Cares will support. So we're going to take a look here at Katie's story.
The last thing you want people thinking about when they're in their golden years is money, or being stressed out about how they're going to pay for certain things. We have a new family member living with us, which is my mother-in-law, Kathleen. She was a counselor in Detroit Public Schools for over 40 years. And I mean, she's really that same person. She has had MS since my husband's been 6 years old. We thought it would be good for the overall family. It'll be great for her in her mental state. It'll be great for our daughters as well in their mental state. They get a chance to have grandma in the house. I mean, like, how cool is that? Walk Cares is a really unique program. It makes it where you really want to invest into a region of living in a place like Washington State, to know that as you get older, you're still cared for and you're still valuable. But now she's in such a good place, and we have, our caregivers that come into the home and help out with her. And for right now, at this stage of her MS, it works for us. They work out with her, and then if there's time, there's some companionship that happens there, where they're just talking and having conversations. She gets showers every day from her home health aides. She seems younger. She's engaged. I think that Washington's a really great place to be able to age. I think Walk Cares will be there for our elderly, our population of people who have done so much in our state and for our state, and they deserve to be taken care of. I also see Walk Cares being very important for our young people as they continue to grow up, as they continue to invest into our region. It's just great to know that if needed, Walk Cares will be there for them.
All right, so that was Katie's story. But really, we're all at a high risk of needing long-term care. So about 70% of us will need long-term care at some point in our lives. And that risk comes, as a lot of us here know, with a high cost. So getting 20 hours of home care each week for 6 months costs about $23,000 in total. And even if you do have a family member that's able to provide care, it's also important to keep in mind the devastating financial impact family caregiving can have on them. And because long-term care is not medical care, it's not covered by health insurance or Medicare, except in some very rare circumstances. And it's typically only covered by Medicaid after you've spent down your life savings just to $2,000. And as we also heard from Katie and her family and their story, paying for long-term care is a problem that's faced not just by lower income families. So most of us don't have enough retirement income and savings to live comfortably, and much less to cover the high costs of long-term care. Even if you do have some retirement savings, very few have enough to get by. So that's what the pie chart on the screen there shows. 41% of Washington workers near retirement have no projected retirement income from a pension, a 401k, or IRA. Another 42% have no pension and only enough 401k or IRA savings to replace less than 10% of their pre-retirement income. That means, though, that 80%, over 80% of us don't have enough savings to pay out of pocket for care as we age. So a public insurance program like WA Cares gives workers really a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and their income is higher. They can then access money to pay for the care that they need later in life when they're on a fixed income. Covering all workers also helps keep contributions low, and once you retire, your contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. So unlike private insurance, which typically requires you to pay out of pocket for 90 days before you can access benefits, WalkCares has no deductible or waiting period. And this is really critical because our population is aging rapidly. So as we can see on this graph here, the population of Washingtonians 85 and older, which is that red line that is ascending, that population group will quadruple from 2025 to 2050. And this slide shows the declining number of potential family caregivers, so folks between the ages of 45 and 64, to adults who are likely to need care, which is folks who are 80 and older. So that ratio is declining from 7 to 1 in 2010 there, and then to 3 to 1 in 2050. And many folks think that if they aren't going to be able to pay for long-term care as they age, they'll be able to rely on kids, right, to take care of them. And that may be true for some families, right? But as we know as well, right, those caregivers experience some significant financial and health impacts. In the future, most older adults won't be able to rely on that family caregiving as an option. And additionally, those family caregivers will also be more likely to be providing care for multiple loved ones at the same time. So for example, someone in their 50s today might be caring for one of their parents or maybe their spouse's parents. 20 years from now, though, someone in their 50s would be caring for two or more older adults potentially. And even when there is a family caregiver available, that care isn't actually free. So many family caregivers have a related financial setback, as we've mentioned, and on average, they spend 25% of their own income on care-related expenses. And caregiving, of course, can be a deeply rewarding experience, but it's also stressful. So almost a quarter of caregivers say that their health has worsened since they took on their role as a caregiver. And it's really common for caregivers to leave the workforce early, right, to provide that care. And caregivers 50 and older who do this lose an average of more than $300,000 in wages and benefits combined. So with these challenges in mind, the state legislature began a search back in 2014 for a public policy innovation that would limit the impact of increasing Medicaid costs on the taxes that we all pay. That would also offer affordable long-term care insurance coverage that provides financial relief to middle-class families and be financially sustainable over the long run. So the committee tasked with this challenge, they spent several years with different stakeholders, policy experts, and actuaries to explore both public and private solutions. And after that extensive research, they found that a program like WalkCares that covers everyone, so similar to Social Security and Medicare, is the only way to provide affordable coverage for all. Public pension, healthcare, and long-term care insurance programs where all workers participate have been successful throughout the world, right, in many countries throughout the world. This approach keeps contribution rates low and also ensures that the coverage for everyone, regardless, ensures coverage for everyone regardless of their age, gender, or health status. So after considering a variety of options, in 2019, the legislature passed a law creating WACARES. In 2022, the legislature made improvements to the program, to the program's coverage and benefits, which we'll get into here shortly. Workers began earning benefits in July of 2023. In 2024, the legislature gave workers the ability to take their benefit out of state. This year, the legislature created a market for supplemental private insurance policies that will work seamlessly with WACARES. This market is expected to go live by early 2027. And they also gave workers who currently have a private insurance exemption a window to join WACARES. And in July of 2026, the benefit will become available to those who qualify. So we'll jump into next how the program works, right? In a general overview first, and then we'll get more into specifics about the program. So to earn benefits, you automatically contribute 0.58% of your paycheck during your working years. And you only contribute while you're working. So if you become unemployed or you retire, for example, contributions stop. Everyone is covered at the same low rate, regardless of pre-existing conditions. And starting in May of 2026, folks will be able to apply for benefits. You'll need to meet a contribution requirement and a care needs requirement, both of which we'll talk more about here in a second as well. Once approved, you get to choose how to use your $36,500 benefit. And it's a lifetime benefit amount that grows with inflation each year. You'll be able to choose any covered services that you want, and there won't be any out-of-pocket costs when you need care. So we will pay providers directly for the services that you receive, again, with no copay or deductible. So just to get a sense of what contributions look like over the course of a career or someone's career, if we just focus on that middle column there, which is a typical worker in the state of Washington that earns about $59,000 a year, they pay about $29 in contributions per month, and that adds up to just over $10,000 in contributions over the course of a 30-year career. And we often get the question of how much someone would have to make in order to exceed the benefit, or exceed their for their contributions to exceed the benefit amount. And that would be that someone has to make an average of $210,000 each year for 30 years, again, in order for their contributions to exceed the benefit amount. So almost all Washington workers contribute to WACARES. If you don't work in Washington, you won't contribute. Federal employees are also automatically not included in the program. Self-employed people are only included if they opt in, and employees of tribes are only included if the tribe opts in as well. Some workers who had private insurance when the program launched have an exemption and do not participate. But for a limited time starting next January, this group can choose to participate in the program. We also see on the table on the right there, other workers can get an exemption from WACARES if they apply to the Employment Security Department. Some optional exemptions are based on meeting certain conditions, and you must continue to meet those conditions to keep your exemption. So this includes workers who live out of state, temporary workers with non-immigrant visas, and spouses or registered domestic partners of active duty military members. In January, exemptions for temporary workers with non-immigrant visas will become automatic. So unless the worker notifies their employer that they would like to participate in the program, they will be, again, automatically exempt. Starting in January of 2026, active duty military members who also work a civilian job can opt out. Veterans with a 70% or higher service-connected disability rating can also choose to apply for a permanent exemption. And we do have this information as well as more information on our website, wcaresfund.wa.gov/exemptions. So if you are self-employed, like we said, you can choose to opt into WaCares Fund and protect yourself with the same affordable benefits that are available to other Washington workers. And just like other workers, you would contribute 0.58%, excuse me, of your net earnings and any gross wages. You must work at least 500 hours per year to earn benefits, and you must apply by July of 2026 if you're currently self-employed. Or if you become self-employed later on, you have to apply within 3 years of becoming self-employed for the first time. And applications to opt-in became available in July of 2023. And again, you can visit our website, wcaresfund.wa.gov/opt-in for more information about self-employed folks. So there are 3 contribution pathways. And again, everyone who is contributing to WaCares Fund more than 500 hours per calendar year is earning benefits, which also includes part-time and temporary workers. So to qualify for benefits, you have to meet the contribution requirements through one of these 3 pathways. We have the permanent pathway on the left there, which will earn you the full benefit amount by contributing for at least 10 years. Then in the middle of the temporary pathway, you earn the full benefit amount if you contributed for at least 3 of the last 6 years at the time that you apply for benefits. And then we have the transition pathway, which earns you lifetime access to 10% of the full benefit amount for each year that you contribute. And this is for folks specifically who were born before 1968. These workers can also earn the full benefit amount if they qualify through another pathway. So someone, let's say, who retires, right, in the next couple of years and was born before 1968 would qualify, potentially for the transition pathway if they kept working, let's say maybe started their own business, or kept working in some capacity, right, at least 500 hours per year, they would keep earning qualifying years and could work their way right to the temporary or the permanent, excuse me, pathway as well, for example. So to use your benefits, we must determine that you need help with 3 or more activities of daily living and will continue to need help for at least 90 days. The activities that we will assess are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. And additionally, if an applicant requires supervision with an activity of daily living due to cognitive impairment, so monitoring, cueing, or setup assistance, that counts as needing support with that activity of daily living. And that way, this ensures that our eligibility process captures not only frail individuals, but also people with cognitive impairment. So when you're ready to apply for benefits, you'll start by creating an online account. You can have someone else help manage your account. Your local area agency on aging will also be available if you need some more support. But once you submit your application, we'll confirm you've met the contribution requirements that we just went over. After that, you'll be able to schedule an appointment to talk about your care needs. And after we have met with you, we'll let you know if you're approved to start using your benefit. So a couple key dates to keep in mind and be aware of. Benefits will become available next year, so in July of 2026 statewide. But before that statewide rollout, we will pilot our entire system in Lewis, Mason, Thurston, and Spokane counties with a limited number of applicants. And residents of those counties can begin their applications on January 6th of next year, of course. Then we have April 1st. You'll be able to create an online account, which you can use to check your annual contribution statements. And eventually that will be the same account that you use to apply for benefits. On May 18th, applications for benefits open statewide. And then on July 1st of next year, all beneficiaries can start receiving services. So once you've been approved, you're able to use your benefits to receive any covered services and supports from a WalkCares provider. So really, this is just a list of what those services look like, right? So you may want to choose services to help you stay in your own home. That can be in-home care, home modifications, home delivered meals, or adaptive equipment and technology. But we also cover many services that support family caregivers. So you can get paid care from a loved one, including your spouse, or you can get respite care so that they can take a break as well. We also cover education and consultation to help them manage your care, dementia and behavioral supports, and care transition coordination to support you when you leave a facility like a hospital. And you can choose to receive services in your own community. That can be adult family home or adult day services. Or you can choose to receive care in an assisted living facility or nursing home, including memory care services. So, we might be wondering how far 36,500, the benefit amount of $36,500 will go. And for about a third of people, need care for a year or less, right? So for those people, depending on the services that they choose, WalkCares may be able to cover all or most of the care that they need. For others, WalkCares can provide your family with immediate relief, right, and also time to plan for future care costs. So these are just some examples of how you could use your benefits. For example, if you'd like to pay a family member for care, you can receive care for 10 hours per week for 2 years, and additionally get care supplies for under $35,000. If you want to make your home more accessible, to keep living there independently, you can make some home modifications, install a personal emergency response system, and also get meals delivered for 3 years for just over $36,000. And if you need short-term help after an accident, you could get in-home care for 20 hours per week for 6 months. Also install a ramp and buy safety equipment for less than $29,000. So WalkCares provides a modest benefit for a modest premium. Some workers may want additional coverage in case that they need care for longer or in a more expensive facility, for example. And the legislature has created new standards for supplemental private insurance policies that are designed to work alongside the WalkCares benefit. So this is similar to how Medicare works. The public insurance provides a foundation of financial security for everyone, and then private options are available for those who want additional coverage. Supplemental private policies will kick in seamlessly once you've used up your WalkCares benefit. And the supplemental market will also give consumers options for coverage amounts and prices, but policies should be more affordable than the current private insurance policies, since WalkCares will cover the deductible. And the policies will also have more consumer protections. And the Office of the Insurance Commissioner will complete rulemaking by May 2026, and policies could become available as early as 2027, early 2027. And we mentioned taking the benefit out of state. So starting in July of 2026, next year, you can choose to continue participating in WalkCares if you leave the state. In order to become an out-of-state participant, you must have contributed for at least 3 years for 500 hours or more per year. and you must opt in within a year of leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. And we're still working on a process for out-of-state participants to report their earnings and pay premiums, but the focus is, of course, making it as easy as possible for those folks. And starting in July of 2030 is when out-of-state participants will be able to access their benefit outside of Washington. And just to start sort of wrapping up here, Walk Cares is a cross-agency program, so there are multiple state agencies that have a role in the program. The Department of Social and Health Services will process your benefit application and determine your care needs, and also manage provider registration. The Employment Security Department manages exemptions, as we reviewed earlier. They also work with employers, right, and process opt-in requests. The Healthcare Authority handles provider payment, and then the Office of the State Actuary is responsible for ongoing financial analysis. All right, and that wraps up our sort of informational part of the webinar. I know there was a lot of information there, but happy to open it up to any questions that you all may have.
Thanks, Sebastian. Yeah, feel free to continue entering your questions in the Q&A function at the bottom of your screen. We're going to take probably about 20 minutes to go through and answer some of these questions. How can WACARES pay caregivers if I've never paid into the fund?
So the benefit amount is for eligible beneficiaries, meaning folks that have contributed, right, for met the contribution requirements as well as have a care need. So if someone, again, has met the contribution requirements and has a care need, then they'll be able to access that benefit amount. They can use that benefit amount to potentially pay, right, a caregiver, which can be a spouse, a loved one, a friend, right, anyone that they would like to be their caregiver. So if someone was an eligible beneficiary, then they could use their benefit towards paying a caregiver, whether that be family or someone else.
The benefit amount of $36,500 will not sustain very long. Will the benefit amount increase?
So the benefit amount will increase with inflation yearly. This is the benefit amount that will be available starting next year, but again, that will increase with inflation. So there's that, but additionally, it's a modest premium for a modest benefit. But for folks that want additional coverage, there will be the supplemental private long-term care insurance policies that are currently being worked on and will be available potentially by early 2027 for folks that do want to purchase additional coverage or maybe, of course, out of need, right, may need additional long-term care support. They'll be able to purchase that through that supplemental private market where Walk Cares will cover the deductible of those policies.
If I've opted out, can I opt back in January?
So that may be referring to the private long-term care exemption that was a few years for folks that had private long-term care insurance when the program began. There will be, if that's the case, there will be a window starting in January for folks with private long-term care insurance to opt into the program. And we will have updates on our website, so I would recommend either checking out our website or our newsletter that will have those updates as they happen.
What is the difference between the transition pathway and the permanent pathway?
Yeah, so the transition pathway, that one is for folks who have an immediate care need, right? And so if someone has an immediate care need and they have contributed 3 out of the last 6 years, then they would be eligible for the full benefit amount. The permanent pathway, on the other hand, is for folks who have contributed for a total, for at least, excuse me, for at least 10 years. Um, and that permanent pathway also um, earns you the full benefit amount of 36,500.
Can self-employed workers opt in at any time, or is it a one-time decision?
So applications for self-employed workers are open to opt in. Of course, if you are currently a self-employed worker, then you can currently opt in. And then if you become self-employed later on, let's say, or you start a business or in later on in the future, then you can apply and opt in and contribute to the fund within 3 years of becoming self-employed.
There's a question about caregiver requirements for family caregivers. I did put a link in the chat for all of our upcoming webinars. Our webinar that will be on October 23rd is all about paid family caregiving with WellCares, and we'll do a deep dive into the training requirements, opportunities, um, everything that you'll need to know about paid family caregiving. So if you want detailed information about that, I recommend registering for that webinar. Um, and there's a few other webinars you'll see for the end till the end of the year if you are interested in any of those topics. Can I keep the benefit if I move out of the country?
So we don't have any policies currently set up for that, but that is something that is being looked into. So currently, it's for folks who move out of the state within the country, right, to another state within the country, then they will be able to access their benefit amount starting in July of 2030. But the being able to access your benefit amount in other countries is something that is being looked into. And again, as we have updates around that specifically, we will provide those.
There's a few questions about the slides. The slides are already available on our website. You can find them at lawcaresfund.law.gov/webinars. And the recording will be available shortly after, either today or tomorrow. If I am no longer working and never contributed, will I be able to use the fund?
So the benefit amount will be available to folks that have met the contribution requirement and as well have a care need. So in order to meet that contribution requirement, right, that was meeting one of those three pathways. And so in order to be eligible for the benefit, then you need to have contributed through one of those three contribution pathways.
What happens if we don't ever need long-term care services?
So WellCares Fund, right, is something that almost all Washington workers contribute to. And it may be the case that you don't have a care need. As we did see right at the beginning, right, there was we know that 70% of us will need long-term care at some point in our lives. Of course, the how much long-term care support someone may need will vary case by case, but it is something that might impact us directly. If it's not us directly, we might have family members, right? And I'm sure we can think of someone who we know, right, or in our community. So if we don't have a care need, then we won't access the benefit, but it can benefit other folks in our community.
Will the new private insurance that will supplement WellCares be less restrictive in terms of being able to qualify people who have been declined by other private long-term care insurance?
Um, I don't have a specific answer for that one, but if we can write that one or note that one, then we can definitely follow up with you more specifically on what that would be, what that answer would be.
Um, does someone who has contributed for 2 years prior to retiring qualify for benefits?
So if you are near retirement, right? If you were born before 1968, so this is that third pathway, then you are eligible for to receive 10% of the full benefit amount for each year that you contribute. So again, contributions began in July of 2023. Benefits will become available in July of next year. So if you were born before 1968, then you would be eligible for 10% of the full benefit amount for each year that you contributed. So for someone who contributed 2 years, they would be eligible for 20% of that benefit amount.
Is there a way to keep contributing after I've retired?
So contributions stop after you retire or if you become self-employed. The only, if you retired, let's say, and wanted to continue earning qualifying years, maybe to work your way towards the permanent pathway, then you could, if you kept working, right, or became self-employed, then you could opt in. But otherwise, once you retire, right, and then your contributions stop.
Can my spouse, who is a non-contributor, utilize the benefit from my contributions?
Yeah, no, that's a good question. So the benefit is not transferable to folks who are not eligible, right, for the program. So the benefit amount is for the person who again has met the contribution requirements or one of the pathways, and then also has a care need. That benefit amount is for them to use to support their long-term care needs. That could be, right, using it for a paid family caregiver, for example, to assist them and help them, but it can't be transferred to someone else, whether it's a family member or a friend. Yeah.
When somebody asked, when will this roll out in Stevens County? So does this roll out in certain counties first and then other counties later?
Yeah, so there is, right, we mentioned the pilot that will begin next year. And that was for the counties of Lewis, Mason, Thurston, and Spokane counties. Those are for, of course, a limited number of applicants. So those are the 4 counties where the pilot will begin first early next year, but then statewide launch will be in July of 2026.
I do see quite a few questions specific to paid family caregiving. Again, if you have specific questions about that, I would recommend coming to our webinar at the end of the month. We'll have the subject matter experts there that can answer a lot more of these detailed, specific questions on that topic. Are there options, again, for when I move out of state?
Yeah, so for folks that want or might have plans to move out of state, if you have contributed to the program for at least 3 years, and then leave the state, you can opt in as an out of state participant and keep contributing to the fund, right, and keep earning qualifying years that way. But you do have to have contributed to the fund for at least 3 years prior to leaving the state, and then also opt in to continue to contribute.
How can I determine when I started making contributions?
So contributions for for almost all Washington workers began in July of 2023. And I say almost all because there are those groups of folks that are not included automatically, right? Self-employed folks, for example. But for the rest of us, right, contributions began in July of 2023.
Am I able to schedule a Q&A section and presentation for my organization?
Yeah. So I'm again, I know we did introductions at the beginning, but I'm the outreach and language access lead. We can share our outreach email maybe in the chat, and that way you and anyone else who may be interested in a specific presentation, we'd be happy to connect with you and work with you on that and see what the best work with you to make that happen. So yeah, we can share our outreach email and that will go directly to me. So I'll be able to take a look at that.
I'm adding a link to our speaker request form in the chat. You can fill out that
Perfect.
form and it'll go right to us. In 1 second after I get this next question. Can you go over the legislative changes that recently happened again?
Yes. So this last legislative session this year, we did have several changes to the program. One of them being the introduction of the supplemental private long-term care insurance policies that will be available by early 2027 initially. So that is for folks who maybe want additional coverage beyond their Walk Cares benefit or need additional coverage beyond their Walk Cares benefit and can purchase policies on top of their Walk Cares benefit. Then let's see, I may go back to that slide specifically just to make sure. Here we go. So I mentioned the supplemental private insurance policies. And then we also have folks who have a private insurance exemption. There will be a window starting in January of next year for those folks to join Walk Cares as well.
There's a few questions here about the care needs assessment, and similarly to the paid family caregiving, we're having a webinar specifically on the care needs assessment, what that process will be, what the assessments will look like. That's on November 18th. If you have specific questions about these in-person assessments, I recommend coming to that webinar. We'll have the folks who will be conducting the assessments. They're able to answer your questions for you. When do supplemental policies, when can I use supplemental private insurance?
So I know that is something that is currently being worked on because of sort of the framework, right, and sort of the network that is needed. So as early 2027, but of course as we have more specific sort of details and information, again, as it's being worked on, then those will be shared as well through our website. So I would again recommend either looking at our website frequently or through our newsletter. Of course, we share all these updates, program updates, so that's a good way to receive those reminders directly about some of the new available services like the supplemental private.
Do beneficiaries have to be over 18 years old if somebody started working and contributed meet the requirements, will they be able to access their benefits?
Yeah, so there is no age requirement to start earning benefits, right? So as long as that person is working at least 500 hours per year, then they are earning qualifying years, and then we'll be able to use the benefit once they meet one of the three contribution pathways and have a care need.
If I qualify for the near retiree pathway and contributed for 5 years, would I be able to receive the full benefit amount through the other pathway, or would I only receive 50% of my benefit using 10% each year?
Yeah, so if you contributed 5 years, then and you were born before 1968, and once you have a care need, then you could earn 50%, right, through that prorated amount. Or if you kept additionally had qualifying years to or met, continued qualifying additional years, then you could earn the full benefit amount through the other pathways. There was that pathway of earning the full benefit amount of after having contributed 3 out of the last 6 years, but that one, someone needs to have sort of an emergency care need, right, to be able to qualify for that full benefit amount. So, yeah.
Like we have time for just about one more question. And if we didn't answer your question here live, we will be responding to you in an email through the email that you registered for today's webinar with for the answer to your webinar. Definitely register for some other upcoming webinars if you have questions about specific topics. The last question is when the benefit amount increases with inflation, will the employee contribution amount increase?
No, so the premium rate is set into law, so that 0.58% won't change unless the law is amended, meaning that has to go to a vote that we would all vote on. But so the premium rate is set. What increases, as you mentioned, is the benefit amount with the annual inflation increases. So that will increase each year.
And we'll do one more. If I've previously opted out, will I be able to opt back in, or am I opted out forever?
Yeah, so that would depend on the sort of the reason for opting out, as we saw for the conditional exemptions. If your situation hasn't changed, then you wouldn't you would still wouldn't be able to opt in. But let's say, for example, if you were had opted out because you had a previous long-term care or private long-term care insurance policy when the program launched in at the beginning,
그리고 또
then
다른
there is a
질문은
window in
예를 들어서
January of next year
개인적인
for
보험을
folks
가지고
who have private
있었었는데
long-term care
지금
insurance to
와케어가 이제
opt
시작이
into the program.
됐어요. 이제 그랬을 때 음, 원래 보험을 가지고 있었었기 때문에 어떻게 되는지 물어봤는데 일단은
And
그 중간에 그
I
기간이
think that's
정해져
all of
있어서
the
다시 그 와케어의 그
time that we have for
연금개혁
questions
그
today.
보험을 들으실 수
We
있는
would like to
그런
hear from
기간이
you
있습니다.
about today's
그 기간에
presentation.
자기들도
If you could take
가입을
a
하시면
few
좋을
minutes
것이고요.
and fill out our post-event survey, it'll automatically appear on your screen once you leave the meeting.
그리고
And
그
then,
저희
as
여러분들이
I
주시는
mentioned,
그 피드백을
slides
받기를
will be
원하는데요.
available on our
미팅이
website
끝나고 나면 거기에 이제
after
설문지가 나와 있을
today's
거예요. 그러면 그
presentation.
설문지를 통해서 대답을
And
해주시면
all of
이제
today's
앞으로
webinar
어떻게 잘 진행을 할
materials,
수
you can
있는지에
follow us
도움이
on
될
social
것이고요.
media, contact
그리고
us
이
through the
외과에
website,
관련돼서는
or
여기 나와
um,
있는 그
call us if you have any
웹사이트에
questions.
주소가 있죠.
And we
거기에다가
hope you had a good day, and we
찾아보시면
see you
되고요.
in
여러분들
another
페이스북이나
upcoming
인스타그램
webinar.
링크를 통해서 찾아보실 수가 있고 여기 질문
Thank you all.
있으시면
Take
여기
care.
있는 그런 이메일을 통해서 질문을 주시거나 전화를 통해서 그러니까 저희에게 연락을 하실 수가 있으십니다. 감사합니다.